Hello, everyone. Thank you so much for joining us today. We're extremely excited to host our wonderful presenter for our educational webinar today on the Alpha Pro system. As attendees are joining us, I want to welcome everyone and just do a few housekeeping things. First off, this is a webinar. It's a webinar format, meaning as you enter the Zoom webinar, we can't see you, we can't hear you, there's nothing to mute. So, but I recommend that you definitely zone into what Dr. Pam has to present today, because it's going to be extremely, extremely beneficial to everyone that is joining us today. The second thing is this webinar is being recorded. And so what that means is that you'll receive the recording of this webinar at the hopefully by the end of today, if not within 24 hours for sure, but we should have it out to you by the end of today. At the bottom of your screen, you can see a Q&A button. The Q&A button is designed to ask questions throughout the webinar. So that means at any time during the webinar, if you have any questions, please do not hesitate to type your question in. Dr. Pam will answer all of your questions at the very end of today's presentation. And so with that, what I'd like to do is I'd like to present our presenter and host today. So Dr. Pam is the clinical director for Forma-TK, and he has an extensive resume that honestly I could spend the entire time talking about. But one thing I'll talk about is in 2014, he co-authored the book, The Acne Solution, which is breakthrough in treating acne that'll work for you. In 2022, he received multiple certifications from Israel Institute of Technology. And as Forma-TK's clinical director, he has extensive knowledge on the Titan Bright protocol and treatment that he's going to explain and describe today. And so with that, I'd like to turn it over to our presenter, Dr. Nadav Pam. Thank you so much for being here today, Dr. Pam.
Well, thank you very much for the extensive introduction. Thank you all for taking your time to join with us to basically speak about the Alpha Pro FDA cleared system by Forma-TK, Israeli private company. And thank you for Aesthetic Management Partners for allowing me to be here today with you in a live webinar. So without further ado, I'm going to start. For those of you who don't know, then the Alpha Pro is basically one device with multiple possibilities. One branch is the diode laser 808, and the other branch is 3D IPL, which we'll focus on today. You also have a melanin meter to diagnose the exact skin type that you have in order to prevent burns and to have more specific treatments per anatomical area. And you have a cooling system inside. So it's one device, multiple possibilities. That means your return on revenue per square meter is extremely high. That means even if you own more than one device and you have just one room and you are just one operator, you can only operate one system at a time. This system is designed to be working 24/7 and basically to bring you back the revenue for your investment in a premium quality results and manufacturing processes. What is the melanin meter? So basically melanin meter gives you results between 0 to 100, and you place it on the body and it reads two different types of pigment, one superficial, one deep. The superficial is something that you can see, and the deep is something that's not always seen by the eye. And therefore it means, yes, we are genetically have one Fitzpatrick, but in different body areas, we have different tan or different concentration of melanin. Therefore, with the continuous sampling of the skin with the melanin meter, we can have a digital diagnostic instrument that helps us to accurately diagnose the patient's skin and not to get a mistake. Is it type 3, type 4, type 5? Okay, and therefore you press the results in the machine and the machine gives you the calibration for the exact energy to have maximum safety for your patient. So we have more than 20 approved indications. And today we are basically going to explain also what the IPL can do. So why we call it 3D? Because we have more control. We have control also on the energy, on the pulse width, and also on the contact cooling. We know that on one hand, overcooling can damage our clinical results, and undercooling can also do the opposite way. So there is always a fine balance, and with this IPL, you can control energy, pulse width, and cooling intensity. Also, we know that by contact cooling, we also do vasoconstriction when we place the applicator on the skin or on the blood vessels. Therefore, we have a less amount of chromophore, so there is always a balance between overcooling, vasoconstriction, and actually producing intense pulse light. That's the IPL, which produce the heat, the photons, and there is always a unique balance in between contact cooling, overcooling, and our 3D IPL, giving you the maximum balance and precision. So today we came to talk about a new protocol that is branded as Tight and Bright. This protocol is aimed to do several topics in one single protocol, both correcting and enhancing, both preventing and fixing also the pigmentation, also the wrinkles, also the telangiectasias on the face, and basically giving it to you in one package and with minimal downtime and maximum safety for the patient. It's a holistic approach. So what is Tight and Bright? It's an approach to treat with an IPL to get younger and healthy looking skin. There are no consumables. It's a non-invasive skin treatment that can be used with our alpha system. It has between 2 to 3 passes. I will explain each one of them. And our aim is to treat pigmented lesion, freckles, age spots for hyperpigmentation, small telangiectasias, spider veins, rosacea, and skin laxity in one combo. So the idea is results with comfort, pigmentation, and texture in one protocol, corrective and preventive. I show you this picture because some people think that they don't really have any sun damage, but in honest that since the moment we are born, our skin remembers everything. And even people that think that they don't have sun damage yet, they might have deep pigmentation that will be revealed later on in their life. Maybe at the age of 60, 70, it will become more apparent as our skin becomes more old and we have signs of aging. But actually, even the age of 30 and 40, with special devices, we can see the deep pigmentation layer that we are already having as sun damage. And therefore, we used a special device to show this filter and to make more emphasize about the existing pigmentation that you have and that you cannot see in a normal daylight picture. So what is Tight and Bright in the approach? The Tight and Bright approach mimics what we know from the radio frequency realm. In that when we do skin heating for the skin surface and we reach to 40 degrees, then we get controlled thermal injury to the dermis, inducing neocollagenesis, elastogenesis, and angiogenesis. Basically, we do dermal remodeling, leading to younger, healthier skin by achieving with an IPL system and not radio frequency to around 40 degrees. And so basically, the skin corrects itself without the need to use any injectables into the skin. So we can also measure it with a non-contact thermometer that you see in the picture. But technically, we can also ask the patient to raise the hand when they feel a bit too warm, and I will show it to you in the videos, and I will show you results. So the process works by 2 to 3 phases. The first phase is basically, let's say if we do the cheek, then we will cover the entire cheek by 10% overlap, single stamping pulses. This is the first session according to the skin type that we have from the melanin meter. And then we have the second phase where basically we have this motion of ironing or basically gliding on the skin with the applicator up and down up to 5 pulses per area, and basically achieving heat in the skin and reaching to the desired 40 degrees, where then the skin has this neocollagenesis and thermal remodeling. And I will show you different body areas where we can apply this, and I will show you results in before and after. So as you can see here in the screen, You have phase 1. Basically, you choose this, you get the parameters, you are done on the same anatomical area, you will choose phase 2, and then the machine will give you different parameters and you can start working. What are the different parameters? So on the phase 1, you can see in the fluence that skin type 1 is 18, skin type 2 is 16, skin type 3 is 14, skin type 4 is 12, but the tip temperature is on constant 5 and the hertz is 1. In the second phase, the tip temperature will be off, so no cooling at all. The hertz will be free, the operation mode will be triple, and the fluence will be between 10 to 8. I will show you videos on how to do this, and this creates the following. And the first pass, you're basically trying to warm up the skin to give the melanin that is in the dermis a little bit excitation to prepare the body for the more intensive protocol that is the second phase. This is what you will show the patient that before the treatment, that this is the what happens to the face before and day by day with the pigmentation. The pigmentation arises from the dermis and it will go to the surface, become scales. You should prepare the patient not to scratch it, and then there will be remodeling. And this phenomena can happen from 1 week to 2 weeks, depends on the reaction of the body. But it's advisable to show the patient this picture before and to adjust the treatment according to their daily activities. So in total, Titan Bright is assigned as 4 treatment sessions, 1 month in between each treatment. I wanted to show you this video so you can have an appreciation of what Titan Bright actually looks like. I hope you can hear the sound. So we have Parker gel, we have the melanin meter, we have the first phase. This is already the second phase when you have the gliding motion. You can do this on the forehead, you can do it on the cheek, on the jawbone, décolleté, and back of the hands. And now I will show you a more detailed approach. No, it's in the second video here. So step 1, you insert the melanin meter, choose bright and tight, phase 1, press OK. The machine will go to standby mode to cooling. You will have the green light to start. And basically you cover the area by 10% overlap. What I recommend is to do first half of the face. So start on the cheek, phase 1, then move to phase 2 on the same cheek, and then move to the contralateral side of the face. You don't have to remember all the parameters because the machine is going to set it up for you according to the melanin meter results. So this is the actual gliding motion on the skin. You are not firming, you need to glide on the skin. You not put your weight on the applicator on the skin itself. Now we have to remember that we are not symmetrically as humans. The heart is in the center to the left. Therefore, one side of the face will get warmer faster. Okay, you can get up to 40 degrees. Areas that contains more fat tissue will get warmer slower. Areas that are more thin will get warmer faster. So I wanted to show you also the approach about décolleté area. Different females have different décolleté area of desired effect. Depends on their religion, depends on what they want. But it's the same first and second phase. So the first phase is basically to do 10% overlap on the desired area. And the second phase is quite similar to, in the parameters it's the same, but the approach to it, because it's different anatomical area, as you will see in the screen. So you do up and down, you divide the area. You don't necessarily have to use all 25 beeps. If it's already reaching to the desired temperature, then you can move to another anatomical location. The machine counts from beep to beep 25 pulses. You will get a long beep like that means you finish 25 beeps. It's just to tell the operator that how many beeps he gave per area. You will get, in the décolleté area, you will get a nice reddish effect almost immediately after the treatment. I wanted to show you this, that just this week I was training in multiple locations in Romania. They all had an alpha in different location. Each picture means a different site in Romania. And I was training in each site. There was at least 3 cosmetician, nurses, and they were doing the training with me. So I was training them on décolleté, on the face, back of the hands, and I could correct each site in real live time. So they were all doing the same procedure. It's easy to learn. There is a reason behind everything. They were all doing the same parameters according to the skin type of their own patient. And it was a great training event. Here I want to show you a collaboration that I did with Nina from Holland. She's a dermal clinician, together with Amal, our colleague, which is also a dermal clinician. And we presented the Titan Bright on 7 patients. That means there were 5 females and 2 males even. And most of them were skin type 2. And they had great result. You will see the pictures of them later on. I just show you that I publish it. And you can see most of them also had just a single treatment here. Usually we advocate it as 4 treatments once a month. So here they had great result even after 1 single treatment. So here it's in focus for the pictures, and you can assess the telangiectasias, the wrinkles, and basically already the results. So I think that those are quite good results, even if it's just 1 or 2 treatments only. Also on the décolleté, but here it was taken with pictures with special filter. So far, I thank you, and now I'm ready to receive questions if you have any.
Well, that's incredible, Dr. Pam. I'm wondering if you could go through the before and afters, because there was such a stark difference in those before and afters, and maybe go through them just a tad slower and describe
Okay.
what the treatment might be like for the patient and
So
practitioners.
in this picture, you can see that she suffers from both skin laxity, wrinkles, and obviously telangiectasias. And basically, and also a bit of pigmentation as well, especially in the cheeks. So by our approach with these 2 phases, you are already seeing results in all the skin itself. So the skin is healing itself from the inside by using our parameters. And the more you will do it, the younger and healthier the skin will look like. Here as well, you see telangiectasias and also pigmentation that have been cleared out on the cheek. Here it's another cheek. Obviously, you see the redness, telangiectasia, you call it rosacea even. So also you start to see improvement in the skin lines. As well here, obviously pigmentation that are starting to clear out, and also the wrinkles. Again, skin laxity. Here there are pigmentation on the skin and a bit of redness on the cheeks, and those are being cleared out as well. And here there were more severe pigmentation above cheeks, chin, and basically it's great result in just 1 month after. Do you have any questions so far?
Yes, we do. It's fantastic and stark differences. The first question we have is from Maya, and she's wondering if this protocol is also able to be used around the neck.
Yeah, so I will explain what neck means for me. First of all, we know that radio frequency and also laser should not be used around the thyroid area, because especially here that we are doing warming of the skin surface, those areas are delicate. So what I do on the neck is the sternocleidoid, that basically I'm going on the farthest side of the neck, and I treat over there. So I'm staying away from the thyroid and all the sensitive body areas, and also I'm treating the underneath the jawline, but I avoid the thyroid at all costs.
Excellent. The next question is, are you able to do this treatment in the summer, or if the client is more tan than they naturally are?
Wait, the good question. Severe tanning is a contraindication for any IPL that I know or laser treatment. So if somebody just went to the sea and he came back in a completely tanned or went to a tanning salon, then it's always contraindication, because basically the skin is oversaturated with energy, and then you will put your energy from your energy-based device, and you don't know how much more the skin can absorb, and that can lead to burn and disfigurement and maybe other side effects. So the idea is that you have to understand who your client is. Is this a person that has intelligence, that you can rely on, there is compliance? Will he put sunscreen, sunblock? Will he avoid the hottest hour to go out in the sun? What is his behavior? If the answer is yes, you can do it also in the summer. If you don't trust the patient to comply, then avoid it in summertime and work in more winter, colder events. But in Israel, for example, we have almost summer for the whole year. So I don't think that even we have other seasons. Even if we have rain or something like that, it's very intensive and for short periods of time. And for most of our time is completely sunny, even if we have clouds. And I'm sure that some states in the United States are also, let's say, desert-like or something like that, or even the climate is changing now. So I don't think that you should say that it's absolute yes or absolute no. It really depends who your client is. Does he have discipline or doesn't he have discipline? Can you rely on him or you cannot? And therefore, choose your patient and decide with them if they can behave correctly in those more sun-exposed times.
Awesome. We have another question from Peter. He's asking about the number of treatments for each of these results. Can you go through and kind of talk about the number of treatments? He's asking if
Yeah,
they're
yeah,
all
yeah.
4 treatments or how
No,
many
no. So
treatments are there?
what we say is that in total, okay, we advise as a company to have 4 treatments once a month, because neocollagenesis, as the term implies, takes 1 month to take effect. Okay, what I'm showing you in this case study with Nina, that she just treated most of them, just one here. It says also inside, you can also take the link and read it after and download it for free. So most 4 patients just had 1 or 2 treatments at all. And what I wanted to show you is that, yes, we as a company will tell the patient that you will see the full effect after 4 treatments. But here with Nina, basically you see that she already got great result even after a single treatment. This is very important because patients today don't have patience. If they don't start to see results, then they might not want to stay with you for a series of treatments. The fact that you can start seeing results after 1 single treatment or 2 will encourage them to keep coming back and asking for it. Yes. Any more questions?
Yeah, that's fantastic. So as we wait for any more questions to come in, maybe explain, are there any areas where you commonly see the Tight and Bright procedure being done? Are there any areas you should avoid? How does that typically work?
So I can treat the forehead, the cheeks, and the lower jawline. If a male has beard, then obviously I cannot work on bearded areas unless that male doesn't want the beard or is shaved. And that will be the male contraindication if they have a full beard, for example, because then I cannot do gliding motion of the up and down. As I said, cheeks, forehead, lower jaw, the lateral external part of the neck. I can do the décolleté. Usually that's a request by females and not by males. So I'm not aware that males ask for décolleté treatments. And I can do the back of the hands. And for some ladies that don't really have hairs on their here on their arms on this part, and they have sun damage, we can also try to do it there. So it depends. I treat a lot of elderly patients, 70, 80, that have mileage. And they did in their past injections. And so I tell them, look, we have a different approach. And therefore you can try ours. And after they start doing our treatment, they don't want to go back to injections because everybody keeps complimenting them about that they look younger, radiant, and everybody's asking, what the hell did you do to yourself that you look so good? And therefore they stay our customers for longer times, even beyond those 4 packages. Just as a company, from the marketing approach, we tell to see the full results. You need 4 treatments once a month. You start going to see results, the initial results after 1 treatment. And the sky is the limit. If you continue more, there is no limit on how many actual treatments you can have. You know that the skin aging and skin damage wasn't created in a single day. It took years to manifest, and it takes time to undo it.
That's fantastic. The next question is, how often do you recommend for follow-up yearly?
It really depends on the needs and the capabilities of the customer, because at the end, it's a private treatment. It usually is not subsidized by insurances. So we advise for a complete treatment, 4 treatments. But if somebody wants maintenance and they want to keep coming back, so he will advise with his practitioner on how many more treatments should they do. And also you have to stay safe from the sun throughout, even after the treatments, because if you do the treatments and you get healthier skin, but then stop protecting yourself from the sun, so the sun will keep giving you damage. It's like going to the gym, getting in shape, and after that neglecting everything you do, and you go back to gaining weight. So you need to keep your lifestyle in a good place.
That's great. The next question from Debbie is, are darker pigmented lesions or capillary spot treated during this process?
So let's say that we talk about this female, okay? And she has in the center of the cheek a more darker pigmented area. Here I can add a third phase that I didn't mention in this presentation. And then I can use a stencil, which basically it's a plastic tool that has different holes in different sizes. And therefore I can shoot an additional pulse, let's say with 20 joules up to 24 joules with a single pulse to try to break the more resilient pigmented areas. And this I can do on the face, nose, hands, or décolleté. So I'm using the stencil in order to prevent the energy to disperse to areas that don't have this concentrated pigmentation. And with this, I can additionally break them down to achieve a more clean, even facial contour and color.
That's fantastic. Maya's asking, in regard to working over beards, if they are freshly shaved and gliding is possible, is there any risk of damaging the hair follicle?
Yeah, the answer is yes. Look at here. Every time you have a hair follicle, it has, okay, if it's not gray or white, it contains melanin. And melanin is a chromophore that will absorb the energy. So if you have a lot of chromophore, which is hair follicle that are dark, then yeah, that means that even on the same energy, they will have more reception, and you might lead to burn in such a way. So the idea is not to have a slight beard, but not to have a beard, and to inform the patient. And if you are unsure, then do a test spot and see how it reacts to that area before you continue to the rest of the areas. But some males, Mediterranean, for example, have much more thicker beard, more concentrated hair follicle per square centimeter. So they will have more reception for that energy, even if they are skin type 1. So it really needs to be adjusted per patient and him. Asian patients, for example, male, usually don't even have beard, so you can do tight and bright on them. But if the more hair follicles you have per square centimeter that are dark, it means more chromophore to be targeted by the IPL.
That's great. The next question is, what is the difference between IPL and a laser?
IPL is intense pulse light that you can visibly see the flash as white. That means it's in the visible spectrum. Laser, it's light intensified. It means that you basically have photons that are in coherent one way. So you need to add usually to laser artificial light to actually see it, because usually lasers are outside of the scope of visible light. And they are basically monochromatic, going to one zip code to the specific area in the skin where they are designed. IPL usually targets between 0.1 to 5 millimeter. For example, Nd:YAG laser will aim up to 10 millimeters penetrates in the skin. Diode 808, it's usually around 8 millimeters in the skin. Some lasers are very superficial. Some lasers are ablative. You need to read about their physics. So it's not one unified thing. So lasers is just that you are using one type of bandwidth, and IPL means you have multiple colors, multiple bandwidths, and usually there is a filter that cuts. That means usually it comes from 400 to 1200, and the filter will tell, okay, I just want excitation phase from 400, from 500 until 1200. In the laser, you'll just choose one number. So they have difference in where they're targeting their energy, their heat, their photons to which part of the skin. According to that physics, you will be able to target those anatomical and homophores that you want according to their anatomical location.
That's great. The next question is, what are the most common contraindications for IPL?
First of all, pregnancy, then any bacterial infection, any skin active disease, let's say you have psoriasis there, any type of drug that is vitamin A derivative from oral tablet in the last half year or 2 weeks topical, and any other photosynthesizer drug that you might possibly take, just like antibiotics, because then your skin is more sensitive to light from outside. There is a lot of large list like autoimmune inflammatory disease, autoimmune active diseases, psoriasis, I would guess, and there are other, but it's mentioned in the book. And also, if for any reason you do not know if a person can take a drug, if their medical history has any other disease that you cannot know everything. So basically, you will consult with a family practitioner or with for example, if the patient was oncological, then you will refer him to an oncologist to have a paper written if there is no contraindication from that point of view. Let's say if there is a hematological disorder and you are not sure if that patient can or cannot stop anticoagulants, then you will go and ask for that specific permission.
That's great. One of the questions I think those are pretty much all of the questions, but the last question I would ask you is, what would you say to a practitioner that was interested in adding this type of device to their practice? What would be your recommendation or thought process through that?
First of all, a lot of doctors have a tendency to go into the injection facility, but the thing is that we know that for any injectable, the body has resistance, and over time, the patient will develop resistance to that form of injection. So that means that with time, they will see less and less effect. And also with our device, basically, we are showing you drug-free or injectable-free approach. Basically, the, the body won't develop tolerance to it. So I think it's safe. Wait. It's safe and effective, and it gives you it addresses several key targets in one treatment.
That's phenomenal, and I think the results really speak for themselves. Seeing the clinical results that you showed are just fantastic. So, for everyone that's in attendance that already owns this device, thank you so much for joining us. As you can tell, we love to have these educational opportunities to optimize your outcomes for your patients. For anyone that's interested in learning more about this device, thank you for joining us as well. We do these types of educational opportunities for as often as we can. We do have another question, and the question is how does this device differ from other IPL devices? I think that's a great question.
So as you can see, we come back to this here. So in our IPL, it's contact cooling, where you can control both the energy, the joules, both the cooling intensity and the pulse width. Not in every IPL that is around there in the market, you can have control over those three elements. With those three elements, you can have a precise outcome. And that's the big difference that we have. So in some other devices, you need an external cooling device. Here, the tip is actually cooled. So for example, if the patient says that the flash surprised him and he reacts to it, you can basically massage the skin with the tip and be ready for the next pulse that you will deliver. So the more ways that you can control all those parameters will decide if your treatment is a success or failure. I do advise to you to try and do your research on other devices, but at the end of the day, remember that Forma-TK with the Alpha Pro gives you premium results, but you don't have to go to the take a loan to to be able to afford it. So our price range is quite reasonable, and we have a device that has low maintenance in average, and we do a continuous training. So I think that the overall package for what you will get, so you will have a basically high revenue on your investment.
That's fantastic. Maya's asking, will this protocol option be automatically added to our alpha? Do you know if it's already included, or I can also get that answer for you, Maya, and send you that answer via email?
So it depends on the distributor, if he sells the upgrades differently or not. So I'm not going to go into that because that's the local, let's say, business approach of the distributor in each country.
Yeah, I'll
But
get the answer for Maya
okay.
and send it over to her. That's fantastic. I think those are all of the questions so far. This has been a wonderfully educational webinar. Thank you so much for presenting. Is there anything else that you'd like to discuss before we adjourn our webinar today, Dr. Pam?
So if after all of this lecture I didn't manage to convince you, then what I would advise to you is to find a local center in United States, if that's in case that you still don't have an alpha right now, and go get yourself a treatment by it. After you will feel it, I won't need to convince you because you will feel it and you will see the results. If you already have an alpha, so congratulations. Please send me your before and after picture from your selected patients and share your success, just like we do in the rest of the world. And I congratulate you on choosing wisely.
I think those are such wise words. Absolutely. Seeing and feeling is believing, as they say.
Yes.
Dr. Pam, what's the best way for people to connect with you online?
You basically connect with AMP, with Aesthetic Management Partners. That's one option, and orchestrate an event like that. I have my own account in LinkedIn. I just passed the 14,000 followers. I
That's
have a
great.
Facebook account. The company has also an Instagram account, which I still don't have personally, but I'm advertised there. It's not hard to find because if you type my name, it's quite unique. No, I don't think there are two another person in the world that has the same name like me. So that's one obvious way. And the second of all is staying connected to aesthetic management partners. And if you have any questions, they are a great team and a great distributor, and everybody knows about them and their quality. So they only keep the top-notch technology. So they wouldn't be involved with us if they wouldn't believe in us.
So true. We do have one more question, but before we ask that question, I want to let everybody know you can follow us on Instagram, LinkedIn, Facebook. You can find us by typing Aesthetic Management Partners, and you will find all of our accounts. We also provide a lot of content via YouTube. We actually have a new YouTube video every week, so definitely follow us there. Obviously, our website has a tremendous amount of information as well as educational opportunities just like this one. And our goal is to really elevate the entire industry as a whole, which is why we go out of our way to provide these types of educational opportunities, which are meticulously planned for everyone in attendance. So the next question is, Pamela is asking, most patients come in complaining about uneven skin. Is this the best device to address it?
And first of all, I need to understand what the definition is, but let's presume that I understand the question. So that this application with the S5 and S30 can also address that. The most important thing is that to take pictures from the patient directly and then 90 degrees and 90 degrees to always show them where they were before the first treatment, because people tend to forget. And when you're taking photos and signing informed consent and do the procedure, they will go with you into this transformation of their new healthier skin, because patients tend to forget what they had before. You will remind them by taking the picture of the before, and with that the success will come. And as I said again, if you don't believe me, just put yourself into the device. If you have a neighbor, a friend, a family member that is old or has already mileage with his skin, put him under the treatment, see the results, and after that you will believe because you will see it. So this works, and I hope that you will enjoy it as well.
Yeah, that's so true. Seeing and feeling is always believing. I love that. I love that you said that. We do have a question. I know the first part of this question, I will actually likely, well, since it's an anonymous question, I cannot send you an email. So please reach out to us at info@amplifymd.com. That's amplify, AMPLIFIMD.com. To ask your question about pricing. We will get you everything we have, or if you have a representative, they can also answer a question based on base price per area, if you will. But the second question is, do we also need a skin thermometer? Can you elaborate on that?
Thank you for this question. Look, when I teach the clinical team or the sales team that needs to sell the device, I prove to them with the thermometer that, look, this, let's say my skin was 33 degrees before the gel, after the gel is 28, and then doing the treatment, I reach up to 40. So I'm doing that. But in real life or real day to day, I'm telling the patient, look, usually they are lying on their back, and I'm telling them, you are my thermometer. That means once you feel that I have reached the temperature that is what you can tolerate, then lift your hand. And the patient understands this reaction, and therefore he tells me when I need to move to the other anatomical location, or I have 25 beeps from the machine that has run over. So if I reach to the desired level of heat even before I reach the 25 beeps, because I don't necessarily need all the time this 25, then I will move to the other anatomical location. The patient will just lift the hand. So they are lying on their back, their eyes are covered, and they basically raise the hand, and then it means I'm going to move to the next anatomical location. So basically I'm in tone with the patient's own feeling, and they are the best thermometer that there is. And they feel that their heat is delivered, and I'm instructing them, let me know when it's going too hot for you or reaching the maximum that you can have, because you need compliance from the patient. And they really understand it. And after the first training, they already know, and they lift, and they don't say anything. They just like lift their hand a bit. You stop, you move to the next one, And this is like interaction with your patient, shows that you are very attuned to their own body, and they are the best thermometer that there is. So you don't necessarily have to have a thermometer next to you in the treatment. It's nice to have, it's not mandatory.
That's great. Maya's also asking, can this be done with the L530?
No, it's with S because first of all, the program is for the S. There are other reasons why it's just with the S, but even think about it. S530 has a smaller tip in the face. You need the smaller area to enter and to walk and to glide. The L has a 5 cm/1. This is a body applicator. It was designed to work on large surfaces in the body, but this is more to more smaller areas. So first of all, I advise only the S530 and not the L, but thank you for the question.
That's a fantastic question and a wonderful answer. With that, I think our the questions have all been answered. Once again, thank you so much for your time today. Is there anything you'd like to say before we adjourn this webinar, Dr. Pam?
I would like to thank the aesthetic management partners for having me again in a successful webinar. It's I don't take it for granted, and I appreciate for the opportunity. Also for me here, it's like almost 9 in the evening, and I'm sure that it's a different hour in your area. So I thank you for putting enough time from your schedule to be here, to listen to it. And I hope you will invite me again for another webinar, another topic in a different date.
Yes, absolutely. Well, we thank you so much for your time today and your knowledge and sharing the protocol and sharing all of the information. I think it's time for dinner and bed soon for you. So once again, thank you so much for joining us, and everyone in attendance, thank you so much for joining us. We appreciate your time, and we hope that you have a extremely wonderful and profitable day. Thanks so much. Bye-bye.
Bye.